Let's suppose we have a known skin cancer and we don't want to take even a wee bit more tissue than we have to. We cut it out right here, freeze it right here, and make our own slides, and know if all the edges are clear, and then we can close.
Okay. So are we, what would be the other thing that you would do here?
Well, some other procedures that we do here, as you can see, would be a table like this allows us to operate and remove warts from the feet or freeze them. We actually can work on the entire body, and we do everything from moles, skin cancer, and even removal of benign growths by another method called curettage. You may have seen these innumerable stuck-on growths some patients have, and those are easy to remove. You'll see here various units we have that allow us to do all the in-office surgery with very minimal bleeding. In fact, a lot of times we don't take patients off anticoagulants. We're able, with these excellent newer versions of cautery units, to do the surgery and keep them on their needed cardiovascular medications.
Now, if once you have removed a growth, and then do you examine it here, or do you send it somewhere else for the analysis?
We send all the growths out for analysis, and it allows us to have no preconceived notion or bias. I may think, for example, that growth looks totally fine, so I'm thinking that when I look at the slide. But if I could send it to an independent observer, so much the better for me and the patient. Then I review the report. Typically, Jen will have a phone conversation with Sue probably 7 to 10 days later. How did my report come out? What more needs to be done?
Okay.
This allows us a lot of follow-up, and then at times the patient will come and we'll talk face to face.
So you send everything out regardless? You don't take any chances?
No. There are a few teeny growths still, such as skin tags, small, very obvious warts that at times we won't. But it also allows us a level of documentation that's very important these days to everything from third parties to employers. And let's suppose Sue moves from here to Wyoming. Now we get a call from her, I have a new mole on this shoulder. Is that related? What did I have on that old one? And I can go back in her report and say, yes, don't worry. The original mole was benign and will not have any bearing on your new mole.
Okay, doctor, we've moved obviously to another room now. Another type of procedure happens in here, is that right?
That's right. This is the laser room, and we have a few lasers that we are able to accomplish different goals with.
Okay.
For example, I'm going to hand Nancy these goggles because eye safety is important with laser. But before we get started, I wanted to tell you this particular laser is on a certain wavelength. I always joke with the patients, you have to be on the same wavelength with your patient. You have to have the same wavelength when it comes to treating the right disorder. This wavelength, Nancy, deals with collagen. So it's going to improve acne scarring, acne, and even fine lines and wrinkles.
Oh, cool. Very cool. Right.
The laser behind you is a CO2 laser. It may not be seen on view, but that's one that removes growths very effortlessly. And then down the hall, we may have a chance to see some of the others.
Okay. All right.
Now, one thing is what's so incredible about this family of laser is it goes right through skin. And I'll just show you, just for example, rests on the patient and moves very quickly along a treatment area. For example, on the face, it meets the contour of the face. And the whole face can be done in about 10 to 12 minutes. Typically, these are what was once called a lunchtime laser. In other words, the person leaves here and has no obvious signs that they were treated. They need 4 to 6 treatments in general, but it's very good for the Elgrove style working patient who wants to get back to work and not get a lot of questions.
Huh. Pretty amazing.
I'll say.
In these uncertain times, America needs a man whose very presence will instill confidence and commitment into this precious land. A brave man who will bring innovation and clarity to the American landscape. That man is... Hello! Ralph the Robot. Fridays at 9 only on Channel 6.
Well, we moved into another room. You said there were other kinds of lasers. I'm assuming that's what this is.
That's right. This is a little bit different wavelength. It's called a tunable dye. We tune the laser to a certain wavelength that happens to hit broken blood vessels, varicose veins, even facial rosacea and redness. It will do nothing to remove hair. It will do nothing for collagen, but it only does what it sees as something red.
So it's a specialist.
It's a specialist. And that's what most of these lasers are, Nancy. That's why we are going room to room.
That's why you have so many different rooms and so many different types of machines.
Interestingly, most companies will tell you, when you're putting on the appropriate eye protection for this laser, that their laser does everything. Really, there's no Swiss Army knife of lasers. Everyone has to have a very focused goal. For example, this one, and you might recognize it has a little bit similar interface, simply is placed on the patient's skin. How are we doing there? And we just move right along, and we can have a small burst of light. That's why we have the eyewear, and the vessels generally shrink quite quickly. Keep in mind, this is for small and medium vessels. Really large ones are not suitable for laser therapy.
So when you say laser companies say their machine does everything, but you say that's not.
That's not the case.
So from experience, you have to decide which is the best machine for treating certain things. Is that right?
Exactly. And that goes a process. We start off by education and educational meetings and teaching, which I do. I've taught at Northwestern University the material science engineers, so we work on the development of certain lasers. Once we understand the basic physics and the difficult part, now we come to another important part. How does it interface with the patient? And a lot of times I'll get a small group of patients try out a so-called new technology and find either it doesn't work or it's unpleasant. These three lasers that we have are out of a number of lasers that we've tried.
So it's been trial and error in a way then.
In a way, that's why they call it the practice of medicine.
Yes, I know. Well, we've moved to yet another room, and another type of treatment goes on in here, correct?
That's right. And one thing we want to just review with our patient, Nancy, is some of the options to make a person look a little bit younger and fresher. This is something that for many years was a problem for doctors because collagen, the old filling material, caused a lot of tissue reactions. About 4% of women were allergic. And silicone lasts forever and has other problems. So about 1990s came up with a whole group of new rejuvenating procedures that are non-surgical.
And how does that work?
Well, very interestingly, the main thing, just like we saw with our nurse consult, is first identifying the problem.
Yes.
That's been one of our goals at Derm. Make first the correct diagnosis, everything flows from there. Here we see in this nice patient a loss of facial mass with these nasolabial folds. We also see a little downturn of the mouth and a decrease in mass of the chin. The old formulation was people would go for facelifts and sometimes look a little bit tight or unnatural. And so what we're trying to do is restore mass. By numbing the patient first and putting a little bit of the injectable material such as Radius, we can restore facial mass, turn the clock back for them 10 to 15 years.
Wow. It's magic.
One other nice thing that you've probably read about, it has all kinds of uses, is Botox. Everything from tension headaches to removal of forehead lines, removal of crow's feet, even raising up the mouth. Finally, people always ask me, why do I look older? And one time you'll see is the lip nasal distance gets larger as we get older. If we can make that lip just a little bit larger with some of the newer filler processes, we're going to make this patient look a lot younger.
So that actually goes right in the lip then,
and that goes
to raise
into
the lip.
One problem, Nancy, is the procedures sometimes get a bad name because they're overdone.
Yes.
One of my hobbies is drawing, and by drawing a lot of faces, I get a rough handle on the proper symmetry of the face and how much to put in for each particular person. Because as we know, every patient is so different.
I think we've all seen celebrities especially talk about having it overdone.
That's right.
It doesn't look natural. You can tell it's not natural.
It's not natural, it's not them.
Right, right. Oh, very interesting. Amazing.
Okay, doctor, bring it on.
I want to thank you very much for taking time out of your busy schedule to be on Strictly Business. I know that I have certainly learned a lot in this short time what goes on here at Elk Grove Dermatology, and hopefully our viewers too will have had an opportunity to learn what's the latest in dermatology. Maybe they will be curious enough to pick up the phone and give you a call and make an appointment.
Thanks so much. I enjoyed speaking with you today.
My pleasure.